Hi, for the care plan in this iSAP situation, I would like to firstly give a brief introduction to COPD, and then I will introduce my nursing interventions for Mr. Dolly. COPD is always caused by a chronic inflammation response in the lungs, particularly in some smaller airways. A COPD is mainly caused by chronic bronchitis and emphysema. They can coexist, but in this case, it will more tend to the emphysema. Emphysema is destruction of alveolar spatus. The destruction increases the volume of air in the alveoli and reduces the alveoli membrane area of gas changing. They can develop to a hypoxemia. Expiration will also become difficult because of the destruction and lead to a hyperventilation and hypercapnia. Mr. Stolley is experiencing many risk factors. Both active and passive smoking, especially active smoking, can be the primary risk factors. Smoking can increase the oxidative stress and enhance the inflammation response in the lungs. Her age also be the risk factors due to the degeneration of organs and a long-term accumulation of all risk factors. Researchers have found that stress and anxiety can have a bidirectional influence with a COPD, so her anxiety should also be counted. Also, she's living alone. This might lead to a malnutrition and reduced self-care and other reductions in her daily life, such as an increased dust in the living environment. And she also don't have a home oxygen device to support her exacerbated COPD. Mr. Stolley is presenting a shortness of breath. This is due to her increased CO2 level in the blood. She is a CO2 retainer. She is also having an exercise intolerance because of the difficulties in expirations and the decreased blood O2 delivery to the muscles. For her hyperinflation, her AP chest diameter might increase. This might be because of the air trapping in her lungs and the loss of her elastic recoil, although the patient denied her cough and fever. But she might deny them due to some psychological reasons and might still experiencing them. A cough can help to clean the mucus in the airway, and the fever might be an inflammation response. Before administering an intervention, physical assessment should be done to record the health data and ensure whether a patient is suitable for the intervention. First, nurses can do an ABCD assessment to give a systematic and immediately assessment and treatment to the patient. There's not much danger, patient responses, and then we can send for help and do the ABCDE. Send for help goes to the escalations. Call a med team can be an escalation strategist. Student nurses can be more involved in the situation to save the time, while the body nurse making a call. We can gathering equipment and do some basic assessment and something like this. Then a med team will come and give some medical interventions for the patient. Come back to the assessment. It perhaps suggested to observe patient's vital signs before a respiratory assessment. Nurses gather the equipment, hand hygiene, and measure and record Mr. Dolly's heart rate, SpO2 level, and other vital signs data. Then the nurse can do a respiratory assessment. In this situation, it might be include a palpation which assesses patient's chest tightness and movement to find out the air trapping situation. And then auscultation. Nurses can focus on the relative abnormal sounds such as the core crackles and whistles of the patient, especially the whistles. Whistles can indicate the obstruction status in the patient airway in some degree. According to the medication chart, salbutamol might be the most suitable medication to be administered in the situation. Salbutamol is a short-acting beta-agonist which can dilate the smooth muscle in the bronchiole, and it only takes 5 to 15 minutes onset. And it is a PRN medication, therefore it should be the most suitable medication to be given as an acute reliever medication in this situation. Mr. Stolley's oxygen level is dropped above the normal range that is expected for a COPD patient in this situation. Nurses may be more suggested to use a Huston mask, for it can provide 35 to 50% of oxygen concentration in 6 to 12 liters per minute. It is suitable for providing a short-term increasing of O2 levels. The key idea of COPD intervention is to correct the oxygen level, reduce the risk of exacerbations, and to minimize the symptoms. I think most urgent in this situation is to correct the oxygen level. Besides, the administered time of a salbutamol requires few hours. Therefore, it might be suggested to give oxygen through a Huston mask to the patient first instead of the salbutamol. Psychosocial factors can have a bidirectional effect with disease. In this situation, to reduce patient anxiety, nurses should prefer calm and use therapeutic communication method to comfort the patient, such as less relative facial expression, brief explanation of the disease and treatment can be provided to the patient. Nurses can also ask patients' needs to increase their comfort, like giving a blanket or set patient up. If the situation allows, stay with the patient. Stay with Mr. Dollis may also somehow decrease her anxiety. For the time limitations, I ignored lots of information and speak a little bit fast. Therefore, thank you for watching.